In this brief video, we're going through the 16th edition of Tabor's Cyclopedic Medical Dictionary. This one is edition 16, and it is edited by Clayton L. Thomas, MD, MPH, consultant in Human Reproduction Department of Population Sciences at Harvard School of Public Health, Director of Medical Affairs, Director Emeritus. And it is published in 1989, so quite a while ago. I'm going over to the brain, which it gives really good lateral, medial, and vascular anatomy of the brain. It gets a lateral aspect, the medial aspect, and the ventral view, as well as the lateral view and the medial view of the brain. Concerning its definitions in terms of the brain, it says that the brain is a large, soft mass of nerve tissue contained within the cranium. The brain is composed of neurons, which we've called nerve cells, and supporting cells. Of course, the brain consists of gray and white matter. Gray matter is composed principally of nerve cell bodies and is concentrated in the cerebral cortex and the nuclei and basal ganglia. White matter is composed of nerve cell processes, which form tracks connecting various parts of the brain with each other. The brain consists of 5 parts: the cerebrum, cerebellum, pons varolii, medulla oblongata, and the midbrain. The weight of the brain and spinal cord is about 1350 to 1400 gm, of which 2% is the cord. The cerebrum represents about 85% of the weight of the brain. The lobes include the frontal, parietal, occipital, temporal, and the insula. The glands consist of the pituitary, the pineal. The membranes consist of the meninges, consisting of the dura mater, external, arachnoid, middle, and pia mater, internal. The nerves are cranial, and of course you want to see the nerve definition as well as the cranial definition. The subdivisions of the brain are: first, diencephalon, including the epithalamus, thalamus and hypothalamus, optic chiasma, hypophysis, tuber cinerarium, and maxillary bodies. Second, myelencephalon, including the corpora, quadragemia, tegmentum, crura cerebri, and the medulla oblongata. Third, metencephalon, including the cerebellum and pons. Fourth, the telencephalon, including the rhinocephalon, corpora striata, and the cerebrum, or the cerebral cortex. The ventricles consist of the cavities of the brain, and they are the first and second lateral ventricles, which lie in the cerebral hemispheres, the third ventricle of the diencephalon, and the fourth ventricle of the medulla. The first and second communicate with the third by the interventricular foramina, the third with the fourth by the cerebral canal, aqueduct of Sylvius, the fourth with the saccharoid spaces by the 2 foramina of the Luschka and the foramen of Magendie. Of course, the ventricles are filled with cerebrospinal fluid, as we have said earlier, which is formed by the choroid plexuses in the walls and roofs of the ventricles. The brain is the primary center for regulating and coordinating body activities. Sensory impulses are received through afferent nerves. These register as sensations, which are the basis for perception. It is the seat of consciousness, thought, memory, reason, judgment, and emotion. Motor impulses are discharged through efferent nerves to muscles and glands initiating activities. Through reflex centers, automatic control of body activities is maintained. The most pertinent reflex centers are the cardiac, vasomotor, and respiratory centers, which regulate circulation and respiration, important for human survival. Brain death. is the cessation of brain function. Criteria for concluding that the brain has died include lack of response to stimuli, absence of all reflexes, absent respirations, isoelectric electroencephalogram for at least 30 minutes that will not change in response to sound or pain stimuli. The patient may be kept alive by life support systems or devices, but death is the inevitable outcome. Of course, there is a caution that some drugs, including barbiturates, methaqualone, diazepam, and others, can produce short periods of isoelectric encephalograms. A brain edema is an increase in brain volume due to an increase in its water content. It is caused by a variety of conditions, but the mechanisms are several, including increased permeability of brain capillary endothelial cells, swelling of brain cells associated with hypoxia or water intoxication, and interstitial edema resulting from obstructive hydrocephalus or brain swelling. Brain fever is also known as meningitis. A brain implant is the transplantation of tissue into the brain in an attempt to treat a disease. Implanting tissue from the adrenal gland into the caudate nucleus of the non-dominant side of the brain has also been done experimentally to treat Parkinson's disease. And the brain scan is a use of radioactive isotopes injected into the circulation in order to detect abnormalities in structure and function of the brain. The brainstem is the stem-like part of the brain that connects the cerebral hemispheres with the spinal cord. It is comprised of the medulla oblongata, the pons, and the midbrain. Brainstorm is a sudden idea, a temporary outburst of mental excitement, often maniacal, especially in paranoia. And then there's brain swelling and brain tumor, which is a term usually used inexactly to describe any intracranial mass, neoplastic, cystic, inflammatory, abscesses, or syphilitic. Except for the latter, the usual therapy is surgical. And the general symptoms are those due to an increase in intracranial pressure, such as headache, changes in the retina, such as choked disc, recognized by ophthalmoscopic examinations, and vomiting without nausea. Mental changes, epileptiform convulsions, and giddiness are often general but may be localized signs. In addition, history and cranial radiological studies are of great value. The injection of air into the ventricles prior to X-ray examination is now known as pneumoventriculography. Neoplasms of the brain do not metastasize to other parts of the body. They contain almost no blood vessels and may produce pain or other sensations, and the most malignant ones in childhood are gliomas. Brainwashing is intense psychological indoctrination, usually political, for the purpose of displacing the individual's previous thoughts and attitudes with those selected by the regime or person inflicting the indoctrination. And so that's, if you look at Taber's 1989 Encyclopedic Medical Dictionary, those are the definitions that are concerning with the brain. I'll probably do another one on other definitions as well. We'll probably go over one concerning psychology and psychiatry, or anything in relation to psychophysics and psychology and psychiatry in general.